Hello, my name is Luke Harmon, and the title of my poster is a comparison of peak EMG for wrist flexors and extensors throughout a full range of motion. Now, the purpose of this study was to compare the average peak EMG for wrist flexors and extensors in concentric, eccentric, and isometric contractions throughout a full range of motion. Now, studies done in this area have typically shown that concentric contractions produce a greater muscle activation. However, select studies have shown that with a lower joint angle, eccentric contractions can produce a higher muscle activation. And for this study, we expect to see that throughout the full range, we would have greater muscle activation with concentric movements. Now, in this study, we had 8 subjects, 5 female, 3 male, and to be included in this study, they had to be between 20 and 40 years old, capable of maximal voluntary contraction and flexibility within normal limits. And they could not have any pathologies of the upper extremity that we were testing, any history of surgery, or any latex allergies. Now, to test this, as you can see in figure 1, we set our subjects up to an EMG. We used a razor and alcohol swab to shave and clean the skin, and then we recorded peak EMGs for isometric, concentric, and eccentric contraction using manual resistance. We had our patient rest their elbow on the table at 90 degrees, and we followed steps A through F to get our data. To analyze this data, we just took the mean and standard deviation, and as you can tell from figure 3, we had the highest muscle activation with concentric movements. However, we had a standard deviation, an average standard deviation between all of our subjects of 22.3%, which is very high for a study like this. Our figure 2, the function of this figure is just to show the high variability between subjects and within subjects. So based on this data, we can conclude that we had higher muscle activation with concentric movements compared to eccentric or isometric, and there was little difference between eccentric and isometric contractions. This is useful in the clinic when assigning exercise. An example would be a post-operative ACL where you're trying to activate the quadriceps muscle. You would want to use a concentric contraction in order to elicit the greatest muscle response. You could also use this data to show that if you're unable to do concentric contractions, it is useful to use eccentric or isometric contractions to produce a smaller muscle contraction. Thank you for listening.